Washington is full of noise, but here we cut through it. I'm Ryann Hill, your trusted voice on healthcare, aging, and disability policy. On Mic'd Up, I sit down with the people driving change to share their stories, insights, and strategies in the Beltway and beyond. Welcome to Mic'd Up with Ryann Hill. Welcome back to Mic'd Up with Ryann Hill, where we shape policy and elevate voices. I'm your host, Ryann Hill, founder and CEO of Indigo Hill Strategies. This is episode 3, and today's conversation is going to be such a good one. I'm joined by Christina Rodriguez, founder of The Pool, which is a market intelligence index for scalable, ROI-ready social care that's quickly becoming a must-read, I think, for investors, payers, health system leaders, and most important to the conversation we're having today, policymakers. I have to start with a really quick story about how Christina and I met. So my firm, Indigo Hill Strategies, we put on a virtual congressional briefing for the Coalition for Social Work and Health back on, I think it was September 19th, the last day that Congress was in session to fund the government. And we hosted this briefing to really champion support for a critical bipartisan bill, HR 4185, which is the Integrating Social Workers Across Healthcare Settings Act. Christina was one of our wonderful panelists, and she absolutely killed it. So we connected on LinkedIn, maybe right after I found you on LinkedIn. And she sent me a message on LinkedIn to subscribe to her wonderful Substack called The Pool. And I immediately said yes, because I love to learn new things and to dive into information that's not readily available to me all the time. So I remember subscribing, opening the first edition that I got in my inbox, and just being so impressed by the level of detail, thoughtfulness, and analysis into the healthcare and social care world. I think it's really rare to see someone connect the dots between market intelligence and social impact and innovation with that kind of precision. And I was just so impressed that I reached out to her just to talk about how she thought about the pool, how she came to the conclusions that she came to, how she found her data, because I was just so fascinated. And by the end of the conversation, I'm like, we got to have you on the podcast so that people can get to know you and the work that you do. And I would love to start the conversation with a question on, your background, but also for folks who may be new to the pool. How would you describe it? How would you describe sort of your experiences and what led you to creating this really important work?
Sure. Thank you so much for that introduction and those kind words, by the way, Ryann. And like I said, the feeling is definitely mutual. Pull translates complex healthcare policy like Medicaid waivers, STARS rules, and value-based pilots into plain English insight about where the money is moving next. So I spent 10 years as a frontline medical social worker, and I consistently saw how so many patients fell through the cracks because of misaligned incentives, and a lot of really great programs that were working for patients, unfortunately, would lose funding or were scattered or were very limited, also due to misaligned incentives. And so I decided to devote pull to breaking down proof and payback and policy, showing how those companies that address social determinants of health, or social drivers of health, I should say, that and how they turn impact into value. So I think of it as the Bloomberg terminal for social care, the one place to see where yeah, where states, vendors, and investors are shaping the next generation of healthcare ROI.
So it sounds like you were able to see from the work that you were doing as a social worker, and I guess interacting with some of these organizations, you were able to see the need to sort of coalesce and bring everything together. How long ago did you start the pool? Is this still relatively new?
Pull is still very new. Yes. I started really researching and developing frameworks for quantifying social care about 2 years ago. And I started writing about it on LinkedIn. And I saw just from the responses I was getting, the need for those kinds of conversation was so much that I needed to have dedicated space for that.
Mhm.
So that's
Mhm.
what the where kind of Substack comes in. It won't live on Substack forever. The plan is eventually to move off, but that's where we're housed now. Um, and yeah, so that's been a few months now, and I recently just went through a rebrand as well because we started as the Fundable 15, where I was only talking about listing the 15 top social care vendors. But as I sort of began to understand the market more, and writing more about it, I realized that there's just a greater need for more synthesis and
Mhm.
more uh, deeper discussions about how to tap those value thesis because it is so complex.
Yeah.
So, yeah. So
So
now
I
we're
would love to dig into sort of the intersection between policy and market forces. I feel like it's a space where you and I both live, and I think that it's a space that we need to broaden the tent and have more people come into. So would love to know where you see the biggest intersections between policy and market momentum around the social care space.
Poll consistently identifies 5 pressure points. So the
Mhm.
first is CMS's pivot into measurable outcomes. So hospitals and insurance plans only get full payment if they hit specific quality goals, things like keeping patients out of the ER, following up after mental health visits, and having clean encounter data. And
Mhm.
actually, some states like Indiana and Florida have created these big withhold pools. These are hundreds of millions of dollars that plans can actually earn back only if their results are accurate and their patients do well. So this
Interesting.
means that certain companies that provide care aligned with social determinants of health are
Mhm.
valuable because they help plans improve those scores and recover lost margin.
Mhm.
The second is after HR 1, CMS began approving 1115 waivers, and that lets states use the federal ILOS rule to pay for services addressing health related social needs. And
Mhm.
these waiver programs are creating these short term proof windows where states who are running these large scale pilots must show measurable health and cost outcomes to keep that federal approval and future funding. The third is Medicare Advantage plans. They get graded by the government through a system called STARS. So those STARS scores now decide how much bonus money that plans get. A tiny zero point 0.1 stars lift can be worth 8 to 10 million per 100,000 members. So naturally, the government also now requires more documentation to back up every metric that affects those ratings. Not only that, but it's additionally expanded supplemental benefit audits to check if plans actually delivered those services that they claimed they did. So insurers and investors are moving toward vendors that can prove that they raised these stars through data accuracy and ROI. And that brings me to my fourth point. CMS now verifies outcomes across multiple payers and audits whether services are backed by clean encounter level data. So, especially in nursing homes and Medicare Advantage. So, because of that, health plans, investors, and state agencies are spending upfront to make sure their partners can pass audits before these contracts even starts. And this gives companies like Unitas, Nuna, and Lumiris, which track patients and connect services, they shift from just being community focused tech to behind the scenes systems that health plans and states can use to produce those results and pass audits. And then finally, the fifth thing is that CMS's new 2026 rules requires plans to integrate behavioral health services into quality scores. So, certain behavioral health companies are now valued as infrastructure because they don't just provide the therapy to the patients, they handle those back end patient engagement, coding, audit ready documentation. And so, that same shift is happening in other areas of social care where community health workers and peer vendors are replacing these older, disconnected vendor models.
So this is so fascinating to me for a bunch of different reasons. My audience will know that I spent nearly 6 years working in Medicare Advantage, a Medicare Advantage policy here in DC. And I feel like I can talk about stars and do often. I was just at a stars conference recently, talking about a lot of these same issues that you're saying. What is so interesting to me about the vendor space is that I felt like one of the hardest things about being in Medicare Advantage is, often talking about that ROI, right? Compared to commercial, compared to other books of business in the health insurance world. And I feel like you do a really great job of sort of connecting those dots, especially for me, and I'm sure for a lot of healthcare executives as well, like these different programs, combined with what's happening at the state level and the federal level, really give the pathway for that ROI. And then it feels like what you see at the end of it is improved health outcomes for the beneficiary or the member, which feels like is aligned with not only the plan goals, but also with CMS's broader goals. And I think those broader goals are going to be agnostic of the administration, right? You're going to have the same sort of push for higher quality, eventual push for lower cost, right? Regardless of who we see in the White House. So I thank you for connecting that dot for me, and I think for others listening as well. One thing that I really love about the pool is that I feel like you do a great job of surfacing what's working, right? Scalable, sustainable models that are actually moving the needle. I feel like I see a lot of ads and I get a lot of emails for different vendors, and I'm not even in the space anymore, and it feels like it's hard to sort of parse out what is real, what is sort of actually sustainable, right? What has a proven track record, right? What has research and data backing? It would love if you can share, and appreciate if you don't want to, get specific here, but what companies or sectors are really getting this social care piece right from a scalability or sustainability standpoint?
Absolutely. So, healthcare used to talk about ROI in social care as a way to highlight how those programs made people healthier and reduced long-term costs. And we saw that a lot in between 2021 and 2023. It was really much easier, faster to secure funding with a pilot and with a deck. But
Mhm.
now it's a math problem about how each vendor saves or earns money and how fast they can prove it. So, health plans care about whether programs improve their quality scores, pass audits, recover withheld bonuses, while investors are more along the lines of wanting models that can repeat those results in
Yeah.
multiple states and build through real Medicaid or Medicare pathways. So, across the Pull archive, companies getting social care right now all share four traits. They can bill for their services today, their data can survive an audit, and they can prove ROI within a year.
Mm.
And they can replicate those same results across multiple markets. Magic number right now for us is three.
Mm.
So they're also not dependent on grants, short-term pilots, or temporary policy shifts. Their
Yeah.
revenue models will hold up regardless of what's happening in policy, and will hold up in real contracts. So the strongest examples have been recently hospital at home programs.
Mm-hmm.
We did a
Hmm.
feature on
Yeah.
Dispatch Health that cut
Mhm.
ER visits and helps improve star scores. Food as medicine is another one, like community servings that saves hundreds of dollars per patient per month. And behavioral health firms like Wayspring and Forge Health that show measurable returns on mental health investments. We also see navigation companies like Duos or Solus Health that convert outreach into member retention, while infrastructure platforms, as I stated, Unitas, PairSuite, and Nuna have become these data engines that payers rely to pass audits. So these are the organizations that have moved social care from philanthropy to finance, and
Mm.
proving that
Mhm.
impact can be billable, auditable, and scalable all at once.
I really want to drill down on the fact that you said that one of the key sort of features that you're thinking about here is that their models aren't based on sort of the temporary policy wins, right? Like, I feel like especially this year, we've seen a lot of transition, right? We've seen a transition not only in the administration, but in the administration's policy priorities. There's been a lot of, I think, guessing, for lack of a better word, as to what the administration wants to do. A lot of sort of picking at little clues from, who they announce as what roles people are in. But I think now that we are, nearly 11 months into the administration, we're starting to see some policies come about, right? We've seen, I appreciate the comment about the grants, because we've seen sort of federal funding sort of ebb and flow in a way that I think no one could have really expected in as big as we saw some of that ebb and flow. And so just really want to drill down on the fact that the ones that are getting it right are the ones that can withstand, some of the policy shifts that we've seen this year, that can do what they do and do it well, agnostic of, what's sort of happening in the federal government. I also want to say that, and some of the folks that you've mentioned are also thinking about policy from a broader perspective, right? A lot of these organizations, I think, are really tied into, what's happening in DC, what the administration is doing. And although no one has a crystal ball to predict what's happening, there are still little tidbits that you can pick up from folks. I was at a conference recently, and one of the questions that was asked of me was, well, what do we as folks in the health insurance world need to do to think about to prepare for, the Trump administration, what they can do for the balance of this year and next year? And so I said to them, you got to get your house in order, right? Like, we don't necessarily know exactly what levers, the agency is going to pull. What we do know is that there is a big focus on artificial intelligence. We know that that's growing every day. We know that the administration is thinking a lot more about audits, as you mentioned, right? And so it sounds like, and these things, the audits and the AI and these pieces are going to be something that will be inevitable, right? Like, we are at some point going to have a really robust conversation about the rising cost of healthcare. We're going to have conversations about the growth of Medicare Advantage as it is on track to have more than half of all Medicare eligible beneficiaries enrolled in Medicare Advantage really soon. And so I feel like the work that you're doing ties, and the companies you're highlighting really ties into all of that, right? It's like, we got to have this conversation about the rising cost of healthcare. We need to address, what's happening really in Medicare Advantage, in the dual eligible space with social care. And I think also you point out, when you talked about, the states that have these funds, there's roles for everyone to play. In the federal government, in the state government, there are roles for, some of these organizations to play as they're starting to see these trends and are able to sort of shift their practices and then help their customers, their clients get their house in order. Because that's really the best thing people can do now, is get your house in order, because somebody's going to come a knocking, and you want to have a really robust understanding of what they could be knocking about before it's too late.
Absolutely. Yeah, when I say these companies don't rely on grants or policy shifts, I mean that their funding and revenue doesn't depend on those short-term variables
Yeah.
or even charitable donations that could disappear next year. On the piece that I wrote up on Dispatch Health, I saw the way that they build the same way that a doctor's office does. They use standard CPT codes, but they use that hospital at home waiver as like a layer over, like a little sprinkle on the top, but they don't rely on that. So instead, companies that survive, they survive by being built into that main payment system itself, and they have contracts with payers that pay them for the specific outcomes or the services that can be billed under the existing codes, no matter what's happening, with in Congress right now.
Yeah. And so much is happening in DC.
So much is happening.
Much is happening in DC, not only from a legislative perspective, but regulatory perspective as well, as we're thinking about, now that we're at the point where folks are starting to have a sense of what the agenda really is, and then how they can fit into it. So to talk about data for a second, I feel like you are analyzing so much data across so many different angles. I would love if you can share from a data perspective, what's standing out to you lately? Are there trends or findings that have surprised you? And then from there, how can folks like you and I work together? How can, policy professionals, advocacy groups better use this kind of intelligence to shape their work?
Yeah,
Yeah.
I think what struck me the most is, like I said, I've been doing this for a few months now, and what's just dramatically changed is I had to sort of relearn everything towards the middle, actually the beginning of the summer. Um, the speed at which payers have redefined equity as cost control, and that the same budgets that used to fund pilots are now underwriting encounter accuracy and stars lift and audit durability. So, right when I was starting to understand that proof replaced passion as a new growth metric, it happened. Um,
I like
so,
I like that
yeah.
proof of passion. Yeah.
Yeah, yeah, that was that certainly proved itself over the last few months. And I think that policy pressure professionals and advocacy groups can better use this kind of intelligence to shape their work by treating data as leverage and not validation. Policy advocates can use these kinds of frameworks to identify which models already meet CMS audit logic and then push for those standards to be adopted broadly. So we're out of the era where we were starting new programs and we were sort of testing what works, and now it's that time is over and it's about scaling what clears procurement.
I think that is what's so interesting about that is the data is like using the data, right? When we have the data, what do we do with it? I always say, as policy professionals, we need to use the data to tell a story, right? And when you can, especially when you're talking to policymakers, be them, be it congressional staff, be it, members of Congress themselves, committee staff, or be it folks in the administration, you have to come with the data. You have to come with the problem, right? The data, and then you have to use that to offer a solution. And it sounds like what you're doing is thinking about you as you're collecting and analyzing this data, talking about how to use it effectively is, I think, such an important piece of the work that you're doing. And I feel like my hope is that people who are reading, your Substack, and soon to be in other places work with the pool, can really see the through line there, and that the data is important, but the data needs to be used to tell a story, right? You can't just present raw numbers to policymakers or to advocacy groups because they won't be able to figure out sort of, okay, what do I do with this? What does this mean? And so much like a lot of the academic work that we see in this space, a lot of the really great research we see in this space, it has to tell a story. It has to have an end goal. And I think that's what, we do so well here out in DC in the lobbying policy world, is using that to tell a story in order to advance, policies and positions that will really move the needle forward to make it so that, we have much more market stability and policies that are encouraging this innovation and encouraging, this really this sort of drilling down on social care, especially as we think about, again, the outcomes. I'm going to talk about this all the time, like that Medicare Advantage is growing like crazy. The duals market is growing like crazy. We're seeing this bigger sort of narrative shift in health insurance that I think a lot of us really weren't prepared for coming into the Trump administration. Now we're at the point where the administration wants to look at Medicare Advantage and health insurance companies as very, very closely, right? And thinking about the audits, as you mentioned, and the data, as you mentioned, and sort of make, with an end towards, okay, how do we make this program better? How do we make it work? And I feel like it's one of the few places of bipartisanship in Congress right now is improving health insurance, is improving the experience that people are having on the ground, be they enrolled in Medicare Advantage or in traditional Medicare or even in the dual space. So why don't we look ahead for a second? I would love to do a little bit of future gazing. Again, we don't have a crystal ball, although I wish we did to figure out what's going on. But I would love to know if you had a bold prediction for where the social care market would be in the next maybe 3 to 5 years.
I think we're going to see social care being formalized as an asset class into itself and priced, contracted, and traded just like any other part of managed care. And I think equity budgets that will live inside of MLR and not outside of it. And I think over time, the those actual vendors that are able to sustain will be those who can prove their value in dollars defended, not dollars donated.
Come on, dollars defended, not dollars. You dropping so many gems. So, last question for you before we head to our outro. How can people connect with or contribute to the pool community?
So right now we live on Substack, so subscribe to Substack. We're under the old domain just to keep it consistent. It's thefundable15.substack.com. And you can feel free to share local proof stories. Send me an email about what's working for you if you're in this space. Try to make it really collaborative. So I'm at Christina at christinar.media. Pull itself is built around transparency. So I make sure that data, policy, and outcomes are a part of every single edition, and that every credible ROI story helps the entire field move from promise to proof.
Christina, this has been such a rich and energizing conversation. I'm so grateful that you trusted us to come onto the podcast and be our third guest. And I just really love how you and the work you're doing is bringing clarity to an area that I feel like is often talked about in theory, right? But rarely measured with this level of depth and intention and really translatability. I think that's a word. In this space. So for everyone listening, make sure you subscribe to the pool on Substack. We'll be sure to include the link in our notes and on social media as well. And as I said before, I think it's one of the smartest reads out there on social care, market innovation, and really a space where you can clearly see where policy meets performance. And before we close, I would like to give a special thank you to Rex Wallace Consulting for their continued support of Mic'd Up with Ryann Hill. Their partnership helps make these conversations possible, and I'm just so personally grateful for it. Thank you again, Christina, for joining me. And to our listeners, don't forget to follow and subscribe and share Mic'd Up with Ryann Hill. We'll be back soon with another episode featuring voices that are shaping the future of health, policy, and advocacy. See you next time.
We all know quality isn't optional. Success in Medicare Advantage and Medicaid demands relentless focus, using data, engaging providers, elevating member experience, and embedding quality in your culture. At RWC, quality is our DNA. Our clients outperform the industry, and our Net Promoter Score of 94 says it all. Whether you're aiming for 4 stars or exceeding Medicaid benchmarks, redefining success in Medicare and Medicaid begins with RWC, because we catalyze cultures of quality.